Hi, my name is Miad Fasalzadeh and my team, Aynaz Barkhodarzadeh and Megan Saghian and I, will be presenting on STIs without borders. Human trafficking is the business of stealing freedom for profit. In some cases, traffickers trick, defraud, or physically force victims into providing commercial sex. In others, victims are lied to, assaulted, threatened, or manipulated into working under inhumane, illegal, or otherwise unacceptable conditions. Human trafficking occurs when a perpetrator, often referred to as a trafficker, takes an action and then employs the means of force, fraud, or coercion for the purpose of compelling the victim to provide commercial sex acts or labor or services. At a minimum, one element from each column must be present to establish a potential situation of human trafficking, the AMP model. In recent years, public acknowledgment of human trafficking has become more relevant with little to no emphasis on the aftermath effects of STDs. What are STDs? An infectious disease that spreads from person to person during sexual contact. Sexually transmitted diseases, infections, are caused by bacteria, parasites, and viruses. Women in the sex industry are already highly at risk of STIs, but women who are sex trafficked experience even more extreme levels of STI risk. Abuse and violence. The U.S. Department of State estimates that up to 900,000 people are trafficked across international borders each year, the majority of whom are women and girls forced into commercial sex industries.
21 million people all across the world are impacted by human trafficking. Many of these people, as stated before, are affected by STIs at a much higher rate, even higher than sexual workers. For example, in Thailand, trafficked female sex workers reported significantly greater numbers of male clients, reporting an average of 33.4 vaginal sex episodes with clients in the past months, as compared with only 24.6 such acts among those non-trafficked. Anal sex, which represents a relatively high level of HIV risk, was 3 times as common among sex-trafficked female sexual workers. Trafficked female sexual workers faced greater difficulties regarding condom usage too. 22.4% of trafficked women reported a recent condom failure, compared to only 12.4% of non-trafficked female sex workers. All of these have increased trafficked female sex workers' likelihoods of getting an STI. For another instance, in Indonesia, the prevalence of HIV among trafficked sex survivors was 5.7%, rising to 19.4% among those trafficked for sexual exploitation of 1 or more years. 1 in 7 trafficking survivors tested for at least one of the 4 STIs, including HIV. Conditions and treatments are also really oppressive for them. 76.6% of the survivors were denied of all movement, and many were forced to use drugs and alcohol. In another instance, in Cambodia, the majority, 52.2%, of female sex traffic survivors identified were under the age of 17, and sexual violence was prevalent. 1 in 4 of these women reported forced sex acts in the context of trafficking and sex work. 73.4% of the survivors tested positive for STIs. In England, 66% of women reported forced sex during trafficking, including 95% of those trafficked for sexual exploitation and 54% of those trafficked for domestic servitude. 8% of the men and 23% of the women reported diagnosed with STIs.
Prevention. There are 2 primary causes of human trafficking: extreme poverty and families broken down by abuse, neglect, addiction, or strife. To prevent human trafficking, you must combat these 2 roots. When this fails to happen, these 2 roots lead to women and children becoming increasingly desperate for a way out. This makes them vulnerable to lies and deceptive promises, such as the ability to get in good schools in another country, or fast-track overseas work opportunities. 1. Help more kids go to school. It's not a new solution, but it's an extremely effective one. Being in school gives kids hope. It helps them believe they can do something with their lives and motivates them to achieve their dreams. When they grow up, they have many more work opportunities to support themselves and their families. 2. Meet immediate and desperate needs. Sudden disasters, whether they're on a household or national scale, can force a family into desperate situations that make them vulnerable to traffickers. 3. Raise awareness about human trafficking. Send teams to surrounding cities, villages, and teach them warning signs of human trafficking and how to protect themselves and their families. Also, counsel men and women who are considering work overseas because of lack of opportunity. 4. Provide women with in-demand job skills. This addresses the broken family root cause as well as poverty. Many women have been divorced or bereaved of their husbands. Others have been abused and had to flee. Others have simply been abandoned. With poor education and no job skills, they have no way out. They're desperate and vulnerable. 5. Provide a safe home for kids out of options. Some kids still have families who love them, but just need some help sending them to school. But other kids have nowhere to go. They've been abandoned and wander the streets. Their parents may have died from AIDS or a civil war that ravaged the country in the 2000s. Some have been abused and ran away. Others were disowned. Some were even sold by their own families into trafficking.
So, now that we have discussed the ways to prevent human trafficking, how do we help those that are already affected? For starters, funding and implementation of a program that specifically caters to human trafficking survivors and screening for STDs and STIs. For instance, the Safe Horizon is a victim assistance nonprofit that has been standing with victims of violence and abuse. Their website has resources that allow for victims of human trafficking to help themselves by being directed to local centers or 24-hour hotlines. Safe Horizon's reach can be furthered if they incorporate avenues through which human trafficking survivors can be connected to local STI and STD testing centers. They can also provide housing, counseling, legal services, education, and job training. In another instance, the Living Water Center is a safe house and rehabilitation center for human trafficking victims. It also helps survivors graduate from high school and apply for college and or job placement. In another instance, the Wellspring Living provides a safe house, education, and therapy for underage victims. It also offers an independent living program which includes continued education and job skills training. The Polaris Project in the Washington area also has a crisis response team with emergency housing, transportation, and legal advocacy. The organization also has a center where victims can get clothing, food, therapy, and or job placement help. For another instance, Not for Sale in San Francisco partners with businesses and employers to find jobs for victims in addition to providing education and shelter. This organization also has locations in Europe, South America, and Asia. But the most important thing of all is that everyone can and should take action. Students, take action on your campus. Volunteer and support anti-trafficking efforts in your community. Some of the organizations that I just talked about, you could definitely join, raise awareness about human trafficking, and probably fund. Make some fundraisers. Consider doing one of your research papers on a topic concerning human trafficking. Request that human trafficking should be included in your university curriculum. For all the business people out there, provide jobs, internships, skills training, and other opportunities to trafficking survivors. For the healthcare providers, learn how to identify the indicators of human trafficking and assist victims. With assistance from anti-trafficking organizations, extend low-cost or free services to human trafficking victims. For the journalists, the media plays an enormous role in shaping perceptions and guiding the public conversation about human trafficking. Do your part. For attorneys, offer human trafficking victims legal services, including support for those seeking benefits or special visas. For you, yes, you listening to this right now, learn the indicators of human trafficking so you can help identify a potential trafficking victim. In the USA, you can report your suspicions to law enforcement by calling 911 or the 24-hour National Human Trafficking Resource Center line at 1-888-373-7888. Trafficking victims include undocumented individuals are eligible for services and immigration assistance.
Additionally, we believe that one of the best ways to address an issue is to get the community, victims of trafficking, affected by the issue involved and hear their opinions. Survivors of human trafficking propose these recommendations. 1. Ensure law enforcement is trained in anti-trafficking. Law enforcement should be trained to be able to effectively identify trafficking and to be able to confront the issue confidently. 2. Create public awareness campaigns that reflect diversity of trafficking victims. Increased public awareness sheds light on the issue and allows for the promotion of intervention to be implemented. 3. Provide support services for all types of trafficking survivors. Victims of trafficking suffer mentally as well as physically and require adequate support. 4. Increase funding to investigate more industries for labor trafficking. In order to defeat trafficking, income is necessary, similarly to most other problems. And 5. Help survivors get on track for success in work and life. The healing process requires getting back to normal routine, which requires help. In conclusion, women in the sex industry are already highly at risk of STIs, but women who are sex trafficked experience even more extreme levels of STI risk, abuse, and violence. To achieve the goal of reducing sexual trafficking and its effects on STIs, greater dialogue is required across the spectrum of responses to sex trafficking and HIV within sex work, including advocates for the rights of both sex workers and children, advocates for the prevention of trafficking, law enforcement policymakers and practitioners, as well as those leading public health efforts to reduce HIV in the context of sex work. Men are human trafficked for sexual work as well. However, there is not enough research about this and not enough awareness. More research must be done on males' experience regarding human trafficking prevention and STI rates. Thank you so much.